What does this pneumothorax actually means? Let me explain it to you. This would be your chest wall. This is your lung. This is your visceral pleura. And this is your parietal pleura. Okay, and this is your pleural space with pleural fluid in it. Now, pneumothorax is when there is air inside the pleural cavity. So, what does this air do? You know, the pleural pressure is negative, right? That's minus 5 centimeter of water, and when air enters the pleural cavity, it increases the pleural pressure. Just like, you know, when you have the two glasses attached with water in between, now you wipe off the water and just keep the two glasses as it is. You can easily separate them, right? This is what happens with the lung. Now the parietal pleura and the visceral pleura are no longer attached, no longer in contact. So what happens there? They get separated. So this space is now completely taken over by air, and your two layers are now separated. Now you may ask me, sir, how the hell did air enter that space? Well, air can enter when there is damage either to parietal pleura or to the visceral pleura. So there comes your etiology now. So what are the causes of pneumothorax? It can be trauma or it can be lung issues like bullae rupture or COPD. The lung issues are usually spontaneous. So this brings us to the three types of pneumothorax, that is traumatic, spontaneous, and the third one, which is known as tension pneumothorax. It's an emergency. Now let me explain each of these pneumothorax one by one for you. The first one would be spontaneous. The name itself suggests that there's no external factor involved in causing the pneumothorax. That is, it happens spontaneously. Now how does this happen? You have a lung surface over here, and there's a tiny bleb, and it spontaneously ruptures. So what happens is it damages the visceral pleura, and air is going to enter in the pleural cavity. So this is your spontaneous pneumothorax, which happens mostly in COPD patients, in case of tall individuals, which is more common in Marfan syndrome, and also in tobacco chewers and smokers.